Hi, my name is Jeanne Phillips. I'm a therapist at Healthy Futures, and I do the family support group. So I'd like to give you a little bit of information about what we would like our families and friends to learn about in terms of helping their loved one recover from an eating disorder. First and foremost, there are no quick solutions. Oftentimes, if you talk to a patient and say, for example, she or he has had the behavior for 7 years and this person is in treatment for the first time, we're looking at 7 years of good practice. They're really very good at this. And now we're going to look for a new lifestyle change. It does take time. There's no 30-day inpatient or intensive outpatient program because we have to go very, very deep. It's not about the individual with the eating disorder. We need to treat the whole family because oftentimes what friends and family will say that seems to make the most sense makes little sense at all, because the eating disordered individual typically has a language of their own. So it's important that we communicate effectively, say what's on our mind, don't focus on food, weight, or body image. I ask my patients to fire the food police. I want you to examine your own opinions, attitudes on people of size or weight. Are you a dieter? Are you a numbers counter? What are you modeling to that person? For those of you who have a child in therapy, it's most important that mom and dad are aligned. Otherwise, you're going to have that triangle, and he or she is going to be splitting. So I invite you to come to these groups, learn what it is you need to learn, and also know in the meetings what I may tell Mr. and Mrs. Jones in terms of how this treatment may go better for them. I would tell Mr. and Mrs. Thomas something entirely different. This is not cookie cutter therapy. It's not black and white. And you will make mistakes. And you will learn how to speak to your survivor, your recovering person, knowing not to focus on what their body looks like, but taking it to a different level. So if I say to you, gee, Ginny, you look great, and I have an eating disorder, what am I going to hear? I've gained weight. So it's focusing on the internal. Gee, Jeannie, it's so good to see you. I've missed your personality. I've missed your curiosity, those kinds of things. Also, you will be accused of being the therapist when you say, how does that make you feel? That's one of the risks. They'll get mad, and that's okay. You just blame it on me or one of the other group members. Your job is to keep them open and feeling safe. The other piece, last piece, and probably most important, is that you get treatment for yourself. This is a very, very, very difficult disorder to recover from. And although recovery is out there, we have to work together as a family. So again, no focusing around food, weight, calories, numbers. Find other things to do other than let's go for dinner or whatever. Let's go ice skating, probably not here in Arizona, but let's go bowling, let's go to a movie. Do things away from the whole idea of food. The other piece is no talk about food at the dinner tables. You're going to have a huge war. Keep it simple. Keep it simple. Again, these people have shame. It's so important that we communicate to them, that we understand at the level that we can, because unless you've really had an eating disorder, it's really hard to understand what I feel fat means. Because what I feel fat means is this person is feeling a lot of fear, a lot of anxiety, and being threatened. So they're really disconnected from their body. Therefore, I would rather feel fat than mad, sad, glad, bored, anxious. And then I can focus on changing my body and not what's on the inside. So again, the whole family will grow, but it's learning how to listen, not be judgmental, and certainly keep an open mind. So good luck. We look forward to seeing you. Be well.